Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. Are you living it up like I am?
I'm living it up. I learned it all from you.
I know. It's infectious, as they say, in a good way.
Yes. So how about our listeners? Do we want them to live it up too?
Of course, and we're going to hopefully teach people today how to heal their musculoskeletal pain. That's the joints, the ligaments, the neck, the back, all the way from the back of the head down to the feet, bottom of the feet, and everything in between, the knees and the toes and the ankles and the hips and fingers. Yeah, we get tons of people with finger arthritis and things of that nature, stiff hands. So pretty much I inject the entire body. I use what is called regenerative medicine, and that is consisting today of using platelets from your blood and using stem cells also. And very simple, you walk into the office, you get your injections, and you walk out. There's no surgery involved. And as everyone who knows me knows, I was in training to be an orthopedic surgeon way back when, in the dinosaur days. And to me, it still is the dinosaur days, because I don't think surgery should be done for musculoskeletal pain unless there's an emergency. And then there's a big question, what does an emergency mean? Different people have different ideas about that, and certainly my ideas are that you better be careful not to have a needless surgery. Way too many meniscal tears being cut, way too many rotator tears being cut, labral tears being cut, and then I get all the patients who the surgery failed. And we don't want a failed surgery. You can get an infection. Things can get worse than they were before you had the surgery. So anyway, that's my point of view. I know everybody else has their own points of view, and that's fine with me. I've been doing this work for over 25 years with very excellent success. It's not going to heal everybody, and there are people that go to the wrong doctors who don't know what they're doing, or go out of the country to places where nurses do this, or where they do IV stem cells that don't really do a whole lot of anything. So we have to be very careful, and that's about it. Nita, what do you got to say?
Well, I do want to remind people that when they call the program today, they get your latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies, actually. The foreword is written by Suzanne Summers, and you're in her new book, A New Way to Age, as well.
I love it, and I love Suzanne Summers, and she is an amazing person. She's an amazing advocate for natural medicine, and she has helped our movement quite a bit over the years. She comes to a lot of the medical workshops that are all around the country. I'm showing a little picture of her in my book, and she's just amazing. She knows more about natural medicine than just about anybody that I know of in the whole planet. And she's gone through it. I've actually done work on her and her family. Her son Bruce is amazing. He likes to ride bicycles, or used to anyway, and fall down. That comes with riding bicycles, doesn't it?
Yeah.
I want to mention these procedures are also used to help assist in regeneration of hair on the head. It wakes up the dead follicles. It's not going to work on someone who's completely bald. I mean, it might, but it's not going to do the whole job unless you did a ton of it. And also on the face, the vampire facelift is very amazing. Very quick and easy. Walk in, get injections of platelets or stem cells on the face, and it regrows the collagen. So these treatments are all about regrowing tissue naturally to regenerate and get healthy again and do it naturally and get your age backwards in a sense. There is something called anti-aging medicine. I don't know if anyone's ever heard of that. And it's all about replacing hormone levels to the levels of when you were younger to help you feel better, help sexual health, help muscle tone and all of that. And this is similar to that in a different way. It's all about feeling good and being young, because being young is what life is all about. Even if you're old, be young. I just met a man in the corridor of my office yesterday, and he had a cane. He looked on the elderly side. I don't know exactly what that means, but I go up and talk to everybody. I said, "How old are you?" And he said, "I'm 92. And I said, "You got to be kidding me. You are amazing." And he had a very strong voice. And I talked to him quite a bit to see what his secrets were. And the secrets that people like that have are generally, don't let the old man in. You've heard of that, Nita?
Yeah, I've heard that phrase.
Yeah, it's a way of thinking and staying active. There is a couple that hikes around in my neighborhood in the mountains in the Palisades Highlands over the ocean. And I see them every single day hiking around. They're in their late 90s. And I talk to them all the time, and I go, "How do you do it?" And they go, "We do it because we do it." Meaning, and they always advise me as the younger guy, I'm 74. They say, keep moving no matter how you feel. And they scold me, just keep moving. I'm usually running, so I'm moving. I want to go to a question, if that's okay with you, Nita, unless you have something else.
Yeah, let's do it. And for the latecomers to the show, you want to give the phone number one more time?
I don't think I even gave it. Yeah, the phone number, and you'll get a copy of my free book if you call in, is 866-870-5752. I'm going to repeat it a couple of times while you go grab your pencils. And if you're driving, pull off to the side of the road, get off your Bluetooth. The phone number to talk to me live right now with Nita is 866-870-5752. That's 866-870-5752. And if you want to call the office, if you want to make an appointment, you can do that at 800-300-9300. That's 800-300-9300. And if you want to email me, you can just go to my website, and on the website there's videos of me doing injections all over the body, so you can watch these procedures, see if you think it's something that you would like to do or send a friend. And the website is www.jointrehab.com. www.jointrehab.com. You can watch videos. There's articles and research on there. It shows the research that I've done, showing how regenerative medicine works using platelets and stem cells. And there's just a lot of information on there for you. So the first question I have, this one we hear every single day: bone-on-bone knee arthritis. So they say the knees go first, and a lot of people say, yep, that's true. That's the first thing that started hurting. So this person says, "I'm 59 years old. I have bone-on-bone arthritis in my right knee. Wondering about whether stem cell injection therapy can help, and what's the success rate of cartilage regrowth, and is that even possible?" Yes. We're going to send you, if you call in right now, a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, and it's got about 250 studies in it, actual peer-reviewed studies that explain how cartilage does regrow. And a lot of surgeons, when I talk to them, they go, "You can't regrow cartilage." Well, yes, you can. Why don't you read the journals that your other buddies wrote and the studies they wrote? So, unfortunately, orthopedic surgery is a slow, advancing type of a study. I like doing it. It was fun. In med school, I did it. In my internship, I've done months of it at a time. I never got board certified in it. Guess why? Because I had a shoulder surgery by my orthopedic surgeon, who was my professor, and it failed miserably. My shoulder got worse. It blew up like a balloon. I had a fever. And at that point, I had to reassess what I was going to do with my medical life. And then I found this, And I've been doing this ever since. I injected my own shoulder, which was literally 4 miserable years after my surgery. And it healed overnight. At that point, I totally woke up, and I started doing this on my patients. Nita, you're smacking your lips. Do you have something to say? It's kind of noisy over there.
No, did I smack my lips? Oh, gee, I didn't even know. But I
You didn't
was
even know you
breathing.
had-
I was breathing. I apologize.
Okay.
I was
Okay.
breathing.
So they asked what the success rate is. Very, very high using regenerative medicine. I'd say in the 80% level if you're going to someone who knows what they're doing. And that's a big key. There's a lot of guys who go out and do a workshop on this and then hang the shingle saying they're regenerative medicine doctors. They don't have a clue what they are doing, and they are literally practicing on you. So be careful. There's a lot of guys out there. I just did a Google search on stem cells last night. I was abhorred with the number of people doing it who don't have a clue what they are doing. So it's like anything else. First thing you do when you call up a doctor is talk to the doctor, not just the staff, and find out how many of these procedures have you done today. And I don't care what that is. I don't care what field, if it's cardiology, if it's urology, if it's rheumatology. Find out. Be bold. You don't want to go to a guy who just says he does something. You want to go to a guy or a woman who does it all day long and has done it for years and years and years. Be very careful. You don't want to go to someone who is hired by a chiropractor for a day when the chiropractor has meetings to bring in people at dinners and then brings in a nurse or a doctor who doesn't do this really. Nothing against chiropractors. Some of my best friends are chiropractors, and I go to chiropractors. One of my favorites, by the way, is Randy Weinzoff in Santa Monica. He's on Broadway in Santa Monica. And I refer to him most of my patients who have radiculopathies. That's pain down the arms or legs from nerve impingement. He gets rid of those. So I love chiropractors. I just don't think they should be having these meetings where they get people who really come to the meeting just to get a free dinner. They're elderly people, and then they sell them these super expensive programs on getting stem cells. That's dangerous. So be careful who you go to. Go to someone who you know does this all day long. Again, if you call in right now to 866-870-5752, I'm going to send you my free book. It's actually not a free book. It's a big fat book that took me 5 years to put together. But you'll get it for free. I'll pay the postage. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And to get a hold of that, call the studio right now. Talk to me, 866-870-5752. And I treat bone-on-bone arthritis every single day of the week. And it's pretty rare that anyone who comes in actually has bone-on-bone arthritis of any joint. It happens rarely. If that happens, generally that joint is not moving at all. If the cartilage is gone and it really is bone-on-bone, you can't move. Now, there's other reasons that you can't move a joint. You could have something like adhesive capsulitis in a shoulder or just a lot of fluid in a knee where you can't move it. That doesn't mean that's bone-on-bone arthritis. And when people come in with their x-rays and show me there's no joint space, I show them that depends on what angle the x-ray is taken. You can have a perfectly good joint and take an x-ray and make it look like there's no cartilage. So you have to be very careful about that also. So yes, we can help bone on bone. I can't help everybody. I need to examine you first. Don't send me your x-ray or your MRI to let me know let you know whether or not I can help you. I need to do an examination and move you around and see where the pain is being generated from. Almost every patient that's referred to me has the wrong diagnosis. How can that be?
That's amazing.
Because most doctors don't touch the patient. They'll do an imaging and then decide what the diagnosis is, and they're wrong. So got to be careful. Don't go into a surgery if a surgeon doesn't touch you. Most people that have failed surgeries that come to me tell me that the surgeon never examined them. They just looked at an MRI threw it up on the board, on the light box, and said, you need a surgery. Look at that. And that's not necessarily showing where the pain is being generated from. You got to touch the area and figure it out. Like the old days, like my grandfather, who was a doctor, who didn't have MRIs. He was born in the late 1800s. He had to examine people. Gee, how weird is that? Do an examination?
What a concept.
Yeah.
Well,
Should I take another?
Would you like to talk to Mike?
Mike in Beverly Hills, you got a neck issue. How long has that been bothering you for, Mike?
Well, I was involved in an auto accident December 24th.
Okay.
And so I just saw my x-rays, and my x-rays show this degeneration, C5, 6, C6, 7.
Okay. Go ahead. Keep
But
telling
I
me.
also have a second question, what they saw in the x-rays.
Okay.
They show a calcified carotid artery.
Okay.
Will that help that?
No. But I have things that will help it. I do have things that will help it. Then not that. Let's talk about the degenerated discs first. Most people have degenerated discs as they age. It's part of the aging process. That just means the discs are drying out or starting to shrink a little bit. I didn't ask your age. Did I, Mike? How old are you? Mike, are you with me?
Yes, I am. A little difficult to hear you, but I'm with you.
Okay. How old are you, sir?
76.
Okay. By 76, it's normal to have degenerated discs. That doesn't mean you have pain. Most people, if you can look this up too, look up degenerative disc disease, and you'll see that it's very common as we age, but it doesn't mean it causes pain. And that's one of those diagnoses that's wrong that I just mentioned. So if someone gave you a diagnosis based on your x-ray that your pain is from degenerated discs, they got it all backwards. I need to touch your neck and figure out what's going on, and I will bet you anything that if you treat with me and get platelets or stem cells, we're going to heal your pain. I can't promise anybody anything, but that's an easy one. You probably had a little whiplash from your car accident, and we can usually heal those up. Okay? Are you hearing me? Yeah.
Yes,
now
I am.
The carotid artery, you need to go get an ultrasound of your carotid artery, because you can have calcification on the outside of the artery that has nothing to do with the blood flow to the brain. It may be fine, but you need to do an ultrasound and see if there's flow inside of the artery. If there's not,
then we'll talk. Do you want me to go get the ultrasound first before I see you, or it doesn't matter?
No, the ultrasound has nothing to do. I'm not going to treat your carotid artery. That's for a cardiologist. I am a physiatrist.
Right.
Yeah, I do musculoskeletal work, but I can refer you. I can refer you to a good cardiologist.
Okay.
You know, the thing for you. Why don't you do this? Why don't you go to my website, www.jointrehab.com, and email me right now and ask all your questions about your carotid artery and whatever else in your body bothers you. At 76, the body is starting to break down, and there are things that need to be maintained. It's like a car. You know, if you have an old classic Porsche or Ferrari, and it's 40 years old or 70 years old or whatever it is, you're going to have to do some maintenance on it. And that carotid artery calcification that was found serendipitously by doing an x-ray on your neck needs to be addressed. You got it?
Yes, I do. My main problem is, like right now I'm talking to you, I have no pain. It's with rotation, primarily extension, flexion. That's
fine. Those are things that I can help you with. Okay?
Okay. So who do I talk to?
Well, why don't you call the office? Call the office at 800-300-9300. That's 800-300-9300. There are people by the phones right now in the office, and if they're busy, just leave your phone number and your name. They'll call you right back.
Okay.
God bless you, Mike.
Thanks for your call, Mike. Our number is 866-870-5752. Right here in the studio, you can talk to Dr. Darrow.
We're going to get to Julie in just a second. Don't hang up, Julie. I just want to mention that one great thing for getting MRIs and X-rays was just shown to us. It wasn't to show us about the guy's neck that has the pain. What was found was something that could be dangerous for him. Serendipitously, he has a calcified carotid artery. If that has a flow problem, if there's stenosis, and he doesn't get adequate blood to the brain, he could stroke. Okay? I'm not saying he's going to, but that needs to be checked out by a cardiologist. So I always get images. I don't believe in them for the musculoskeletal part, but I do it to make sure there's no cancer, there's no carotid artery stenosis, things of that nature in the neighborhood that we're looking at, because those can kill people. Okay? So, Julie, Dr. Marc Darrow, your husband has a shoulder issue, and how old is he?
Yes, and I also, he has some trouble with his knees. He's 78.
Hey, Julie,
And,
Julie, can you hear me? You got to turn the radio down because we're having echoing from it.
Oh, I don't understand why, because I'm out of the car. Just a minute. Something's beeping on my car. Just a minute.
Okay. Maybe you're on a Bluetooth.
Well, I guess it's not my car. It's somewhere.
All right. Well,
Really
we'll
weird.
put
I'm
up
sorry
with
about
it. No problem. So
Let me take you off for speaker. Maybe that'll help.
That'll do it. There you go.
Okay. I need to find my husband because he knows his body better than I do. Just a minute.
Nita, are you laughing yet?
Yeah.
He's 78, going to be 79. And he's been complaining about his knees hurting him when we walk, and he shuffles, which I keep trying to get him to pick up his feet, but he says it hurts.
Okay.
So, just a minute. I'm sorry.
Why don't you do this?
Where he's at, and I heard your program, and I was like, okay, I'm calling because he's been wanting.
Listen, why don't you do this? Why don't we take this off the air for a moment? We'll stay with you. When you find your husband, we'll put you back on. Is that okay? And then in the meantime, we'll go on. Is that fine?
Yes, that's great. Thank you.
Don't hang up. Just stay with us. We're going to take care of you, okay?
Okay, thank you.
All right. God bless. Hang with us. Nita,
Yeah, so I put her on hold.
There you go.
We're good.
Wonderful. So I'm going to take another question, if that's okay.
Sure.
Let me see.
You want to give the phone number? Well,
I do. We'll get some more callers, too. The phone number to talk to us live right now is 866-870-5752. But first, I'm going to tell a joke to Nita. Nita, you ready?
Okay, ready.
I want you to think visually on this.
Okay, visual.
What would bears be without bees?
Without what?
Bees.
Beans, like beans you eat?
Bees like bzz.
Oh, bees. Asleep.
They'd be ears.
They'd be ears. Okay, let's move on.
What do you call a pile of cats? A meowton.
Meow. Oh, that's a good one. I like that one.
Nita, you're going to get this one. You ready? 1, 2, 3.
Yeah.
Why did the bicycle fall over?
Because the person didn't put the kickstand on.
That's not a joke, Nita. Because it was too tired.
Oh, that's a good one.
Okay, I'm going to give you one more, and after that...
Are you sure?
After that, you're going to get a dunce cap. You better get it. What did the triangle say to the circle?
Move over. Roll away.
You're pointless. Stick with us, folks. We're going to go to a break. Give us a call live right now, 866-870-5752.
All right, this is Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens. We'll be right back.
Listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.